Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. The Northwest Arkansas Tobacco-Free Coalition serves Benton, Carroll, Madison, and Washington counties by working toward the elimination of exposure to secondhand smoke, reducing tobacco advertising, and promotion of targeted towards the youth, as well as reducing youth access to tobacco products and linking people to cessation programs to help them stop smoking. The coalition and their community partners believe the key to reducing the tobacco burden in Arkansas is through local efforts. And joining us today to discuss those efforts is Tyler Clark, the project coordinator for the coalition, and Chanita Neal, the smoking cessation coordinator from the community clinic. Thank you so much, both of you, for joining us today. We appreciate it.
Thank you for having us.
All right, Tyler, tell us, what is the purpose and mission of this coalition?
Well, Dr. Nesheiwat, you spoke about it actually, really eliminating the exposure to secondhand smoke, helping kids address tobacco-related advertising in the area, also reducing tobacco-related ads. We know that oftentimes kids are exposed to lots of different ads when they go into a convenience store. As you mentioned before, eliminating secondhand smoke, the dangers thereof. Policies, we help pass policy and initiatives to actually address the dangers of secondhand smoke. Also address tobacco-related disparities among Marshallese, Hispanic, African-American, and also youth as well. So address those disparities. We do focus groups to kind of address those issues of what's the best way to approach that community, what disparities actually exist, and then also linking people to cessation programs, as you mentioned before. 1-800-QUIT-NOW is the Arkansas Quit line. We refer people to that program often, and then also we have a lot of local programs in Northwest Arkansas we refer people to.
Very good. Is this a new coalition? When was it founded?
Oh, not by any means. We're 10 to 11 years in operation, actually. We've been around for quite some time. We're a strong coalition, 125 members. We're actually the oldest tobacco coalition in Arkansas. So we're really here because of Initiated Act 1, which was the 2000 vote, essentially. The Master Tobacco Settlement dollars were brought to referendum for the Arkansas state voters to actually vote on to how to actually use those dollars. So we're one of many coalitions in the state that focuses on Washington, Benton, and Carroll counties, I mentioned before. So we focus on those counties through that Master Tobacco Settlement dollars, and we're one of a handful of states that actually use that money actually to tobacco-related programs. So we're very lucky in Arkansas.
Which is exactly what we need. Why is this so important, not only for those who smoke, but for the non-smokers as well?
Sure. Well, I want to share some numbers with you guys, if I could. People who identify themselves in Arkansas as smokers is about 23.3%, actually. Washington County identified themselves as 15.8%, and Benton County is 17.2%. So that's people that self-identify in a telephone survey that they actually smoke cigarettes on a regular basis. We're lucky in Washington, Benton County to have the lowest rate of tobacco usage in the state, and that's obviously to our efforts here at the Tobacco-Free Coalition. But also, that number also means people die from tobacco-related illness. Over 4,900 Arkansans die each year because of tobacco-related illness. For every 10 non-smokers, one non-smoker dies. So that counts for about 510 non-smokers in Arkansas alone. In Washington County, smokers who died, to put it in perspective, 339 smokers in Washington County, Springdale 109, Fayetteville 120. So put that in perspective of actually accidental death, that's suicide, car accidents, HIV, liver disease, worksite accidents. Only 69 in Fayetteville died last year. So to compare that number to smokers who died, 120 to 69, that's almost double people that died accidentally in Fayetteville alone.
Staggering statistics. Can you imagine if we didn't have this coalition in place? Those numbers would just be outrageous.
Sure. Well, if we know if we have any impact to reduce the tobacco burden in Arkansas, we're doing a good job, and we've seen that number come down considerably over the years.
What is a typical day in prevention control?
Well, if there's any typical day for us, it kind of runs the gamut. We could be giving a class to youth, to community members, leaders. We guest lecture at the University of Arkansas quite often. We're developing multimedia campaigns, social networking campaigns to get the message out about tobacco. Linking people to cessation programs. So our office is always a buzz. We're always being called for quotes on tobacco-related issues, and really the actual benefit to us is that we're here in Northwest Arkansas. We have a pulse on what's going on here, so we're actually really advocating and educating people about tobacco burden here in the state.
All right. Tell us some of your achievements in the past 10 years.
Well, I'd like to brag, obviously. since we formed 10, 11 years ago, we were really in the forefront of helping Fayetteville become smoke-free. In the Smoke-Free Fayetteville Days in 2004, were instrumental in educating and advocating for that issue. We also helped Ozark Guidance become smoke-free. The University of Arkansas's new smoke-free policy, we helped advocate for that and educate the student body and the students about that as well. And also, we're so proud that when we started 10 years ago, the smoking rate in Washington County was 38%, and now it's down to 15.8, which is the lowest in the state. So that's half the tobacco burden reduced.
That is fantastic.
And we know that's because of tobacco policies, and we got to give credit to our community members and community partners who actually work hard to ensure those policies are enforced, and that we educate people about those policies too.
Absolutely, and especially to those people like Chanita, who helps coordinate smoking cessation programs.
Absolutely.
Is that right? Tell us about that, Chanita.
Smoking cessation is, in and of itself, just quitting smoking. Not just smoking, but any type of tobacco, dip, chew, the like. It's really getting in there and talking about the reasons why you smoke, the reasons, the ways you to quit, as well as how to live a normal life now that you are not having, that you're not smoking or you're not using tobacco. And so helping them just trying to change their behavior and change their life at the same time.
Very good. How does one gain access to your services at the community clinic? Is that correct?
Yes. Well, our patients our people who come to our classes or our program have to be eligible for the program. They have to call our clinic and call a community clinic at 751-7417, extension 860, and then we can set them up with a class, and classes preferably start every month, and it lasts for 4 weeks, 1 hour each week, and it just goes over those things I talked about before, all the ways to help them quit.
What are the benefits of smoking cessation versus just quitting cold turkey?
Well, 40% as an increase, 40% increase in using the medications, especially Chantix. Chantix is one of the more newer prescription medications, and it basically helps a person with their withdrawal, and the class helps them with their physical habits of just a hand to mouth and things they do periodically throughout the day. And so quitting cold turkey sometimes, or just by themselves, doesn't give them the support that they get from a class, and that camaraderie and having somebody else there to say, you know, you can do this, we can do this together in the class.
Very good. Tyler, how does the coexistence of each of your organizations help benefit one another in our community?
Well, Community Clinic is the fiduciary of the Tobacco Free Coalition, so that's a blessing, obviously. A lot of coalitions statewide don't have that blessing of a strong fiduciary. But obviously, we're educating about the dangers of tobacco. We've got to have an outlet for people locally to gain cessation information and actually quit the habit. We can preach all day about the dangers of tobacco, but if you don't give them an option to quit, there's really no benefit to have the prevention or the education talk. So the two of us work in tandem quite often. The Tobacco Free Coalition and Community Clinic work side by side to really to eliminate that burden. So without the two, wouldn't it be possible?
Very good. How can one get some information to join your efforts with your coalition?
Sure. Well, we love, we're again locally here in Springdale. Our office is based out of the Harvey Jones Education Building here in Springdale. We have a website, nwatfc.org. They can always call our office at 872-5350. We're always looking for people who are interested in joining the coalition. We run a wide variety of people who are healthcare providers, who are concerned citizens, people who are just passionate about advocating for tobacco-free Northwest Arkansas. So we'd love to have those people who want to learn more about us.
Sure, great. And Chanita, just from your experience and the people that you've worked with, other than we know smoking can cause lung cancer and COPD and emphysema, what do you think? How do you think it actually has an impact in the lives of those people that quit smoking from your experience in running the smoking cessation programs?
The people who come to the class and finish the program have a better quality of life. They, with their family or their children, their whole life just really changes. They have this sense they can actually continue to live life, and they not be so bound by some of the things that happen once you do smoke, lung cancer, COPD, some of those things can be reduced or even get better over time. And so they can breathe better. They can feel their circulation in their arms and their legs just gets so much better once you quit smoking. Even the way they can smell and taste now, it changes them. So they're like, oh, we have so much success over the course of the program, and people are just so happy that they get an opportunity to quit and have something help them to quit as well.
And reduce the risk of stroke and heart disease as well.
Absolutely.
Very good. Can you share a success story with us?
There's so many. There's so many. We have a lot of people who come to the class and they have no way of accessing or getting the medication to help them. And they say so many times that patches and gum lozenges are so expensive, as well as the prescription medication. And they're like, I can't believe this. How are y'all able to do this? How can you give me this at a reduced cost or free? This has helped me so much in my quest to quit smoking, and I couldn't do it without this process. So overall, it's the same. The success story is kind of pretty much the same.
Very good.
Overall.
Very good. All right. Well, Tyler, Chanita, thank you both so much for joining us, and thank you for everything you do for us here in our community. We appreciate it.
Thank you so much.
All right.